A new era is unfolding in breast cancer treatment with Inluriyo, imlunestrant, bringing fresh hope to patients worldwide. Breast cancer is not just one disease but a collection of different types, each requiring unique treatment approaches. Among these, hormone receptor-positive breast cancer remains one of the most common, and one where innovative therapies can make a life-changing difference. With the arrival of Inluriyo, patients and doctors now have a groundbreaking new option in the fight against this challenging disease. One of the most common types is hormone receptor-positive breast cancer. In this cancer, tumor cells use hormones like estrogen to grow and spread. Doctors often treat it with hormone therapies that block or lower estrogen, slowing the cancer down. But for many patients, especially those with advanced or metastatic disease, the cancer eventually finds a way to outsmart these treatments. A major reason for this resistance is a change in the ESR1 gene. This mutation makes the estrogen receptor, the switch that turns cancer growth on, stay active even when drugs try to block it. For patients with this mutation, standard hormone therapies become less effective, leaving limited treatment options. That is why the approval of Inluriyo, imlunestrant, marks such a turning point. This new oral medicine is the first drug designed to directly target ESR1 mutated breast cancer. Instead of only blocking the estrogen receptor, Inluriyo binds to it and forces the cancer cell to break it down and remove it. By eliminating the receptor, the cancer loses its fuel source. Taken once a day as a pill, Inluriyo provides an alternative to injections, giving patients more convenience and freedom. It is specifically approved for people with ER-positive, HER2-negative ESR1 mutated, advanced or metastatic breast cancer, whose disease has worsened after at least one round of hormone therapy. Before starting, doctors confirm the ESR1 mutation with a blood test. The approval was based on the large EMBER-3 clinical trial. In this study, patients whose cancers carried the ESR1 mutation and received Inluriyo lived longer without their disease getting worse compared to those on standard endocrine treatments. The medicine reduced the risk of progression or death by 38%, improving median progression-free survival from 3.8 months to 5.5 months. While the numbers may sound modest, they represent a real and meaningful extension of time for patients facing limited options. For many, what also stands out is quality of life. Patients on Inluriyo in the trial maintained better overall well-being and daily functioning compared with those on other treatments, and because it is a pill, it fits more easily into everyday life. Like all cancer medicines, Inluriyo can cause side effects. Some of the more common ones include anemia, low white blood cell counts, nausea, fatigue, changes in liver tests, joint or muscle pain, and changes in cholesterol or calcium levels. Most were manageable, and doctors closely monitor blood work during treatment. One important warning: Inluriyo can harm an unborn baby, so pregnancy should be avoided while taking it. The arrival of Inluriyo matters because ESR1 mutations are common in advanced hormone receptor-positive breast cancer, affecting up to 40% of patients whose disease has returned after earlier therapies. For these patients, treatment options have been frustratingly limited. Now, for the first time, there is a targeted oral medicine built to overcome this exact challenge. Inluriyo does not cure advanced breast cancer, but it opens a new path forward. It shows how precision medicine, matching the right treatment to the genetic changes in a tumor, can change outcomes and bring hope to people who need it most. For more clear and insightful breakdowns of breakthrough medicines like this, follow Drug Insight Hub, your trusted source for drug discoveries, approvals, and how they impact patients.